Hey, you guys. So I was just on the phone with Sean, and we were talking again. And I was talking about that thing about living up to your diagnoses. Those words sometimes are like hard to say. Don't try it all the time. But say, for instance, you go to the hospital and they say you're diabetic, and then you look up all this information about diabetes, and you're like, well, I'm just a diabetic. I'm going to live up to that, and then you become diabetic. Or if they say you're depressed, and then you're like, oh my God, I'm depressed. And then you start living up to the expectations of your depression diagnosis, and that's all you become. Same thing as if you're an addict, they diagnose you with a chemical dependency issue, and they say, well, you're just an addict. And then you're like, well, then I'm going to be one. I'm going to live up to that. And you get in that mindset and that trap of, that's all I am. That's all they expect from me. That's all that. It's the same thing with heart disease too. Well, you got a heart disease. I got to do this and this and this and this and this and this. And then I got to take more and more and more medication and more and more and more and more and more and more and more. Maybe if they said, well, like I told Sean, I said, what if they said, you're just human and you've got a human illness. Lots of people get that. And, or you've got a mental health issue and a mental illness issue. And that mental health issue means that it's not all like this. And whose mental health is all like this? I don't know anybody whose mental health is just like, and if yours is like that, well, unless you're dead, and then it's probably like, but if it's just like that, then there's no joy, there's no sadness, there's no joy, there's no sadness. It's just, and people might look at you, Stephen, and think, well, you have no joy. It's just always sadness and darkness. And you're like, well, just because I look like, doesn't mean that what's going on inside my mind isn't like, isn't fluctuating or changing from minute to minute. When someone would say, well, you're just a sponge sometimes, you like suck up what's around you. And maybe some of that is true. Maybe. I mean, but who doesn't do that? I'm getting these people in the back. I don't like videotaping people without their permission. It's not right. I'm like, hold it. No. It is, I'm in a restaurant. I'm at McDonald's, so I probably shouldn't use their name on video, but it's where I'm at. One of these days, I'm going to just take this out and I'm going to sit on the street and I'm going to just have a conversation. I'm going to ask somebody, can I have a conversation with you? And I'm going to say, what do you think about X, Y, and Z and this or that? And they're probably going to look at me and go, but I'll find somebody who will want to do it. And we can have a dialogue, like they'll sit on this side and I'll sit on this side and I'll position the camera right. So it looks like two talking heads are just, But I want you to think about that. Well, I think about it, about living up to a diagnosis, living up to an expectation of mental health. What if you told your doctor, I have mental health, and that means I'm healthy? Because humans suffer from a wide spectrum of disorders. And I don't want you to label me as manic depressant anymore. I want to be labeled as a human being with a wide spectrum of disorders and mental health. Well, they won't do that. You know why? Because insurance won't pay for mental health. They'll go, well, you're not sick. Do you see what I'm saying? And you'll say, no, but I need somebody to help treat me or to help me. And I'm not sick. I have mental health. No one would like that. I mean, insurance companies wouldn't like it, because how could you classify that as a ICD-9 code or an ICD code or whatever they're called now? Could you, oh, where do we put that? You know, and why not? I said that before. Who gets permission to see their psychologist and talk about a mental health issue when there is no disorder there or no illness? What if you just needed to talk to a clinically objective person and say, I'm not mentally ill, I have mental health issues, and that means I'm healthy, but I need to talk to somebody about some issues in my life? Well, they wouldn't let you. They'd have to say you're depressed. They would have to classify you as a diagnosis in order for you to see somebody to talk about a clinical issue. And is that right? Well, people would say, no, that's not right. But insurance people would say, well, there's no illness, there's no disease. We can't classify that as, you know, you just want to talk to somebody. And you know, I know you just thought about that, right? It's true then. I mean, then I'd be like, oh gosh, I've been seeing those therapists and they've been, you know, charging the insurance companies for this disorder and this disorder. And I was like, a lot of times it was like, I volunteered to talk to them, you know, and I was probably depressed. And you know what? I probably did live up to them. Well, I'm just depressed. I might as well just lay on the couch. And that becomes a self-fulfilling prophecy over time. It's like, well, they say I'm depressed, so I might as well act it. Because you know why? Here's the killer. I'll get some sympathy and some attention from people I might be seeking it from. And it's not, and maybe at the time you can't see it. You can't see that that's your behavior or that's action. But when you take a look at it from over here and you're like, was I just living up to that depression disorder? And was I just seeking attention from people and I didn't know how to ask for it? And that's hard to do when you're in it. It's really hard to do because you're like, they tell me that I can be, that my behavior is going to be like this. And I might be really sleepy. I might be, oh, and they'll give you all these symptoms and you're like, yeah, I got that. But you might be like, I've had that since I was little, you know, restlessness, sleeplessness. And so they'll rattle off vague symptoms and then you'll be like, yeah, I got that. And so you see how it like builds, how they can just say, well, if you got 3 or 4 of these, and I love psychology, it's a great field, but see how it's built in some flaws? And some people know this, but they just won't say it. Well, because they would be like, by the APA, and by a lot of people, they'd be like, demon, you know? And so it becomes a circular trap, and you get trapped in it. And it's the way the system works. And so I don't know how to change it except to talk about it. And then make people think, what are we doing? Or what have we been doing? And can we change it before it's too late. Because, you know, the new DSM-6 should be coming out, you know. I'm sure there's going to be a disorder of, you know, proportionate, you know, there'll be something about something. But what they really should do is they should look at treating an individual differently. And they should treat from mental health perspective, the perspective of wellness, that you're well. And humans suffer from these, they do. They suffer from like being spontaneous and making choices, making bad choices, making good choices. Like some people make the choice to drive without a license or drive without a seatbelt. I mean, you don't diagnose them with stupidity. I mean, and then say you better go see somebody. I mean, you can say that, but I mean, so mental health is like, we're all healthy, we're all well. It's just that humans suffer from these conditions, and people do. And the only reasons we have words for them is so we can bill, so that they can bill insurance companies and get money. I still say they should have a diagnosis, wellness check with clinically objective person to talk about interpersonal problems in their life that could help them manage day-to-day living. And then it'd be like, and I mean, that's a long diagnosis, but it might as well be like cyclical mood disorders with inability to sleep. I mean, who doesn't have cyclical mood disorders? I mean, doesn't your mood kind of go like this sometimes? Happy, happy, joy, joy, happy, joy, joy. I mean, or no, it should go, right? But sometimes it's not all that. Sometimes it's like, I don't feel so good, I feel good. I don't feel so good, I feel good. I just had something really bad happen in my life and it's situational. And sometimes it's like that situation lasts a long time. And that's when they get you, is they get you when a situation lasts longer than 3 months or a few weeks. But no one wants to help you in the beginning, like when it happens. And sometimes your friends don't know what to say, and they're the worst sometimes because they're either like, I know what you're going through. And you're like, you want to say thank you. I mean, you say thank you and give them a hug, but you want to say, no, you don't, because you're not me. You know what you went through and your stuff, but you're not me with my pain and with my grieving and or with my joy and my, you don't know that on my personal level. And people don't do that because we're polite. People don't, I mean, I do. I'm like, yeah, you do not know what I'm going through. I mean, even if you've been through similar incidents, you know what your own incidents are and how you managed it given your life circumstances and given your individuality. That's because we're not all carbon copies of each other, and not all diseases are the same, and not all management is the same. You know why? Here's why. Because everybody's made differently. And everybody, depending on what they've eaten, how their psychological makeup is, how their stress reactions is, you know, what kind of medications they're on, what kind of this, what kind of that, what kind of this, what kind of that, what kind of spirituality they have. All this stuff makes the person individual. And all of that has to be considered. I mean, sure, you can say, you can treat the kidneys the same because they're kidneys, but people aren't kidneys. And people aren't, you know, solid organs. I mean, you know what I mean. They're not just one individual, it's not a specialty. A person isn't a singular special. I mean, you gotta like get the whole picture in there. And that's why generalists in the old days were good. Because they kind of were like, we're gonna look at, we gotta look at all of it. And I mean, specialists are good for treating, and they know a lot they know a lot about a specific thing. But when you come to talk to them about other things, it's like, oh, wait a minute, you got to see somebody else for that. And then by the time you're done seeing one doctor, it's like, oh God, I've got a doctor for this, a doctor for that, a doctor for this, a doctor for that. And you don't know who to go to. I got to see a renal doctor, a liver doctor, a kidney doctor, a heart doctor, a head doctor, a general practitioner doctor. Then I have a nurse practitioner. Then I've got a nurse who sees me, and then a home care. It's like, who do you call? People, no wonder why people get confused. I told Sean, there's something in coffee that's really good for people. But well, getting back to that diagnosis things. Do you want to live up to a label that somebody gives you? And I said that before. I said I don't like labels, but I have to use them because we live in a world with them. But do you see what I mean by I don't like them? It's because people can live into those labels. Do you know what I mean? It becomes a trap for them. Well, you're homeless. You're a whore or a slut. You're depressed. You're crazy. You're rich and snobby. And I worry that we teach kids those things, and then they're like, "Yeah, well, I'm a prima donna," or "I'm, no one likes me. I'm a loner," or "I'm an outcast," or "I'm ugly," or "I'm fat," and then they grow into that. How? And that's not, well, it's not a very good way to like run a world, So I guess I challenge, I don't know who watches. No one's on here now, 0 viewers. What's live? So I don't know what's the right thing to do. Do you challenge the medical community and say, I want wellness checks that's available and covered by insurance, so that people, before they get to the point of getting a diagnosis, can get some intervention and professional care? Or do you start when you're really young, and you build this foundation that says that, and remember that thing that I talked about, that research study model that I designed when I was locked up in the psych unit for my so-called mental illness? Well, I wrote a study about, we teach nurses, doctors, and nurses did it. Those silly nurses. That's why I'm glad I'm not a nurse anymore. Well, we teach people about pain, and we ask them every day, every visit that they see the hospital people, every time, how much pain are you in? 1 to 10. And they say 10. And they're like, well, we teach people that pain is not acceptable, but we also breed this concept of pain into the lives of children. Well, children know the pain scale, not acceptable pain, but you watch kids and they fall and they don't cry because no one's looking. And so what I said is, why don't we talk about quality of life and start asking people, how much quality do you have in your life? And start breeding happiness and wellness into the thoughts and minds of people, and get rid of that pain business and I will start talking about good things, but get rid of that pain stuff. I mean, sure, assess it, but I mean, start looking at how much joy and happiness is in your life. And I bet you it might be a reflection of about how much pain they have. And so you could get rid of the pain. And stop asking people every time you see them. And that's the first thing what's your pain level? It's like, I don't know yet. It might be 10 after I'm done talking to you. But it is true. It is true that that we constantly talk about pain. And I'm not talking about me. I'm talking about my pain because I want to like get it out there so that the rest of my life can be happy, happy, joy, joy, or, you know, something. But looking at that thing about, no wonder why people are like, oh, I've got to go to the doctor. What? They're just going to ask me how much pain I'm in. And, you know, even people who have chronic pain issues and who are on pain medicine, they still get up. They still go to work. They still manage with what they can. And there must be something. But they are taught to say that if I say my pain level is 10, I'm going to get more attention. And we teach that to kids. The higher your pain level, the more attention you're going to get. You know why? People are starving for attention. And some intervention. So what if we did that thing with joy and happiness and quality of life? And then if you had a lower quality of life or happiness, that's when you do like, you need some attention, or, you know, you need some, it'd be an inverse kind of relationship. Not that I know anything about that. But I'm just thinking that I sent that to Abbott Hospital, to one of the George Institute for Health and Healing, or whatever it's called, to this guy named Michael. I was like, well, I'll just write it. Somebody else can do it. Because I was like, I don't have time. Well, I wasn't a nurse either, and I wasn't licensed, so I don't have to do anything. So it's just, and like I told you before, most of my memories from childhood are negative. Well, because I had to talk about them time and time again. And I'll try not to talk about them anymore. I'll throw them in, like, examples in every once in a while, but you probably already heard most of them. There's some that you haven't. And there's some that I haven't heard before because I don't remember. Like, there's a big chunk of time that's still missing, especially in California. And I don't know. I don't know. It was probably a protective measure, but it's kind of like out of mind, out of sight. And so I'm like, well, do I need to know? Or is it haunting me inside my mind somewhere? But I actually literally can't access it. Like I turned it off. It's like gone. And I do remember I used to say that in my mind when I was little to get over things. I can just turn that off and delete it. And I don't mean this stuff. I meant like the things in my mind. I can just, and I think I practiced that because I had to. And I'm not saying that that's right or wrong. I don't know if that's right or wrong, to be honest. I don't think it's up to me to decide either if it's right or wrong. I think it's just something that I did because it was a protective measure. But I literally sometimes when I was younger would say, erase that, erase that. And it was like this little mantra, like, and so I don't know if it's ever retrievable. Well, it is because it's still in there. You know, memory, like I said before, memory doesn't matter if it's real or imagined. It still feels like it's real because you can recall it, actively recall it like it really happened. And so isn't that like dreams? Dreams aren't necessarily real, but when you recall a dream, you recall it like it really happened. Like you can see it. And so I don't know. I don't know what the right answer is to anything really. I'm just throwing out stuff that I do know this, that the mental health system has to be revamped. And I bet you would help a lot of mental, like I said, mental health. It would help a lot of people who don't have who don't have diagnoses. It would help them before they get to the point of being classified as something. And I honestly think I did, you know, here's the thing. I did like the thing about in the old times when people went to wellness farms, or can you imagine if your doctor said, I'm really sorry, I have to tell you this, but you need a wellness break and we're sending you away for a week in the country and it's going to be really nice. It's a spa. And you'd be like, oh, is insurance going to pay for that? Oh, yeah. It's a wellness break. Everybody gets them now. You'd be like, what about my job? Oh, it's covered. Insurance covers that. And you're like, how many do I get a year? I mean, wouldn't that be nice? And it could be just, I'm going to a wellness farm and everybody got it in the country with their insurance. And you could use it once a year, just like, I need a week of wellness. And you could go out there and just be like, I get away from the city. I get away from the, you know, and if you had kids, somebody would they would send in somebody to take care of your kids for a week, or you could take them with you and just be like, and it was covered by insurance. Maybe that would save it might save a lot of marriages. It might save a lot of money if you think about it. You're like, it would be on top of vacations. It would be like, there you go. I don't know. I bet you somebody would find a way to make some money off that and start a good business popping up all over the country, like wellness areas where it'd be like, and it's covered by insurance. Just an idea. And, Minnesota would be like all on that, I mean, in the long run, that would really make sense. It would make people happy. It'd be like, I get a break for a week once a year to go to a wellness and talk about wellness and just be like, and maybe help out. Like if there was stuff around there to do, like be part of it. But can you imagine like how that would, if you changed the way we look at assessing pain to joy and happiness and quality, added wellness retreats once a year for people that were covered by insurance, changed the way mental illness was diagnosed as mental health. What would happen to the mentality and the mindset and the wellness of the country? Well, I don't know. People might start thinking, why weren't they doing this in the beginning? Well, you know why? Well, insurance companies and pharmaceutical companies and medical fields want to keep you sick. You know why? It's a moneymaker. So it is a moneymaker, and that's not, we knew it in the past. Medicine knew that in the past, that people needed a break. And they were like, that's why they sent him on these wellness farms. They sent him out. They're like, you need a break from the city. Go to the country for a week. And, well, when you were mentally ill in the past, they're like, oh, you're going to the country. You're getting out of the city for a minute and you'll be back. But I would like to see if they ever instituted that thing at Abbott that I sent about instead of assessing pain, assessing quality and joy and happiness. Because I think, I'm not going to go to work an hour and a half early just to stand there. I'll wait and I'll go my usual hour early. So yeah, it'd be interesting if we had like that trifecta effect, doing the assessing pain level and changing that to what I said, then looking at mental illness as mental health, and then looking at coverage for wellness retreats through insurance. And since we have national insurance now, everybody would be covered. Thanks. And it wouldn't, some people don't get away. Some people don't get away. They don't get a chance to get away. Or maybe they don't want to get away and they wouldn't use it. But some people would be like, I need a wellness break before I go insane, And some people would use that. And it wouldn't be a drain on insurance because you know what? Insurance companies aren't stupid. They would find a way to like sell t-shirts at the fair or, something. I mean, they would find a way to like, but it would be good for people and it would change the entire mindset of the country. And would that be bad? It wouldn't be bad. It would be like, you know what? It's about time we moved from a disease model of medicine and people into like this other model of, into another model. I think for far too long, we've looked at people as disorders and diseases and diagnoses, and we forget to look at people. And all we look at are these numbers, like these. Your code is 1967443, and I'm gonna pretend that I'm an actuary. I'm gonna pull that, and I'm gonna look at all the 19673s in the entire United States, and then I'm gonna say, oh, well, there's a lot of them. And you're like, well, I'm not really even a 19763. You know, that's just what they said because I said yes to answers 1, 2, and 3. And you're like, well, what are you then? Well, I'm really not on the ICD-9 list. Well, how can we have, you know, it's like, well, actuaries don't care about that. They just pull the numbers. They don't ever ask anybody, are you really in 19763? And they're like, I don't even know what that number is. I just pulled it out of the air. But you know what I'm saying? Is like, and then you're a big company and you're like, oh, I'm going to I want all that data. I'm going to pay for it, pay the government for it. And then I'm going to target all those 19763s with whatever I want, with special medication, with special this, special this, special this. I don't know. I could be wrong, but I'm probably not. And like I said, I was going to school for nursing, for my master's in nursing informatics, and I quit in that last class, data management. Well, and I said I don't want my nursing license back because I'm glad I'm not in that mess anymore, because I saw what they were doing and I saw what it became. And while it was good money, I have more fun at the restaurant. I told Sean this morning, you know what? And I'm going to try to do this today. In a lot of ways, I'm treating people at the restaurant as not, you got a 2-top on A4, and it's like the same thing. It's like, well, I want to say, well, what's their names? But that's too personal. And we want to all be detached from the other person. I did. And I still reactively do that. What's your name? Well, can you imagine if you were in a restaurant and you were like, what's your name? But do you see how it's the same thing as in nursing, where it's like, you come in, you order what you want, and then somebody gets it for you. Like in nursing, people would say, I want something for pain. Okay. Run to the kitchen, run back. Here. Okay, and then how are you doing? Same thing at the restaurant. I ask people what do they want, run to the kitchen, run back. How is everything? Except I usually do it with a smile. And nursing, I got to be tough. How is everything? And so, and they're still, oh yeah, that's, you know, Szechuan whatever and so-and-so on table 4, and you can say that. I bet you if you looked at a lot of other things, that you would be, it's a lot of similarities in a lot of things, and a lot of stuff, and a lot of companies and businesses. And that's why I said sometimes a different perspective, even if it's like from a different field, is interesting. And they started doing that in nursing, hiring non-nurses as managers, because it was like, you know what? Non-nurses don't have to get involved in the nurses stuff. They can just manage. I mean, and nurses didn't like that because they're like, well, they don't know. And it's like, they know how to do business. And that's what the hospital cared about, was business. You know, sometimes I think if I was running a healthcare corporation, I would be like, You know who I wanted to run it? I'd be like, get somebody from every department, not get some regular people, staff people from every department, put them in a room and let them find out about how they want to, you know, not fight, but just talk about it. And let them shadow. Like, say, I want one of the people from OB to like shadow the CEO for a month, paid, and then bring that information back to the department and be like, I hate that job. I just like taking care of patients. But, and the same thing with the CEO is like, have them shadow, like I said, have them be a mystery janitor at one of their offsite locations, or be like, I'm going to be here and I'm going to work as a janitor today or for the next month, and I want to see what you're doing. A lot of those executives have never, you know, they've gone right into like high paying jobs. I mean, some of them have worked their way up. But I think that really good executive leaders and really good leaders know how to get dirty. I mean, and go, you know what? I don't mind doing your job with you. I don't mind. And then they could see, gosh, you don't have any time. They only give you, I was telling Sean this, when I was a nursing assistant, I sometimes felt so bad, but it was money. And I was like, they give us half an hour to get 14 people out of bed and dressed and then get them to breakfast. It was like a short period of time. And you're like, it was a factory, you said. And a lot of nursing assistants and PCAs can attest to that. It's like, if you're working in a nursing home on the day shift and you get there at 7 o'clock and breakfast is at 7:45, you're like, 8 people? Are you freaking kidding me? And my sister, I told my sister, and she was right. She goes, well, why do you get them up if they don't want to get up? And I'm like, well, they don't have a choice. It's breakfast. And she was like, well, what if they don't want to eat? And it's like, well, back then it was like, too bad. You're going to get up anyways. You can just sit. And so, yeah, I'm guilty for this. I'm guilty for that and for that training that I had. And I guess what I'm trying to do with some of this talking about my own personal experience is to see my education and see where that ended me up at and where I want it to go. But you can see, I don't know, maybe you can't. I mean, there's one viewer. Maybe it's just maybe I was right too about just talking about it. It does help me. And it makes me think I was just as guilty as all of them were. And I'm glad I see differently now. I don't know what to do about it. And most of it is like, I would just speak it so it was my truth. And if other people wanted to do anything with it, that's them. You know, I just really want to like get out all the things that I can so that I can look back and say, well, my opinions have changed, or I was right on. And I'm glad things did take a change. I bet you people don't even realize what's being done in healthcare, mental health, insurance, and well, I said this before, universal electronic medical charts, a brilliant move by lobbyists. Brilliant is right, and Obama did it. And I'm not saying, I mean, I voted for him. I'm not saying that we shouldn't have been on medical records, electronic medical records, because we should have. But behind that was this need for like data management and data mining and pulling all of this information out of the networks. Well, once everybody's online, I said this before, somebody can sit in an office in DC and just go, and then go, minutes. And then you really do become a number. And not just one, but many. And, well, you said this too, or I did. I said I knew ways of like, but who in God's green earth would want that? You know? Well, and I do believe that electronic records are good. I just think that there's ways, well, I said it, nurses, you'll learn. Well, you probably already know, some of you. And if you want to know, you could just ask me. I would tell you how to do it. I said once, I called the University of Minnesota and I said I would come and speak to nursing students about my experiences in my life. And well, I would talk to medical students too. But I would talk to nursing students about where my life, how it started, and my issues in my life. I could talk about sexuality, child abuse, sexual abuse, drug abuse, working life, after working life as a nurse. Yeah, and I could talk about hospitalization, the patient aspect of it. And that time when I was in the hospital for acute pain for that lifting that piano, I was like, oh, here's my history, so you know it. And then I was like, I told that one nurse, I said, I'm gonna just be a patient, just please take care of me. And I think that's a hard thing to do because I was just like giving it up to her, I didn't want to get out of bed to go to the bathroom. And the steroids hadn't hit yet, like that they give you for the inflammation. And I was like, once those hit, I was like a basket case, like crying and firing people and like, you know, I don't know. I've kind of been rambling now. I went from that to talking to the University of Minnesota students in nursing. But there's a lot of good ideas out there by a lot of good people and a lot of different perspectives that are never heard or never acted on. And it's a lot of times this is because people don't give them the time of day. And it's just interesting. Like I said, you can learn a lot on the bus and just by overhearing. And, you know, I don't write those random quotes by strangers. I did the other day, I wrote one, but I might start doing it again because it's like, and Sean says, well, those ... you only hear what you want to hear. And I said, I pick out what's important to me. And it might be, I told him, I said, you know, that's how people write research papers. And that's how they get grants. And that's how they take snippets out of big documents. And don't even get me started about most of the research that I wrote. I only quoted things. I didn't like take the whole idea. I was like, or not quoted, but I took like one part of it and then I wrote the rest myself. You know, and reading the whole entire research, I was like, I learned how to read research papers pretty early. I was like, and to be like, not going to use any of that. Just write what I think. And I did take things from both views. Like sometimes I was like, the source. I said that too. What they should make you do is look up each individual and look and see where their funding came from. And then see if you really wanted to use that source, or who created the research project in the beginning, not just the writers. I mean, where was the money at? That's damning. The other thing too is, here's that ring I bought myself. Silly. Well, that's what I did. I just took pieces of research, pieces of it, and then wrote my own views on it were. And I don't know. Sean said, well, your psychology is wrong. And I'm like, it might have been bad research or made up research that somebody else wrote for me to like, and then I just wrote my own ideas. It might be that. It might be just crazy thinking too. But I don't know. I challenge people to challenge their healthcare providers and be like, if you need to see somebody, if you're not depressed, but you need to talk to somebody, tell them to make up some non-NOS, not otherwise specified disorder. Well, don't tell them to make it up, because then you'll be labeled as that. And then every time you go to the doctor, it'll be like, oh, he's this and she's this. You got this. Wouldn't it be nice though to see, oh, if on your chart it said well-being, and you're like, oh, that means I'm a good person, or I'm a well-being. Get it? A well-being. And healthcare workers had to look at that and they go, well, they're a well-being? What the hell is that? And it goes, they're well-being. And then their mindsets would be like, oh, they're in good shape, they just need to see me. Instead of, oh, they're depressed. Another one for the day. Now instead of seeing 5 depressed people, I had 6 or 7. And that's what it's like. I've got 7 depressed people on my docket today to see, or 6 schizophrenics. And it's not like what if it said, I have 7 well-beings with mental health issues that include disturbances in thought patterns. Disturbances in thought patterns. Who doesn't have that? You know? I do. I'm like, I'm here, and then I'm there, and I'm like, hell, the bus driver has disturbances in thought patterns when a car comes in front of them. You know? I don't know. Just think about that. Think about, do you have 7 well-beings to see, or do you have 7 schizophrenics, or 7 depressed people, or 7 colies, or 7 gallbladders, or 7 heart attacks, or 7 psychotics, or 7 drunks, or 7 IV drug addicts, or 7 pregnant women, or you know what I mean? Just, do you have well-beings to see, or do you have diagnoses and conditions to see? I want to see well-beings, and that means I already understand that they are this. They're everything. They're good, they're bad. Sometimes they're indifferent. Sometimes they're happy, sometimes they're sad. Sometimes they laugh, sometimes they cry. Sometimes they're straight-faced, poker-faced. Sometimes they're mean, and sometimes they're really good and helpful. They're not just a drunk, a coli, schizophrenic. And they're not just lithium, Mellaril, whatever the drugs are now. Those are old drugs. I just pulled those out of Strattera, Adderall. They're not just all of that. And I figured out something. I said before I probably have attention deficit disorder. I probably do. But I'm not going to take anything for it anymore. Like, I'm not going to go get a Adderall, which I was going to get because I thought maybe it would clear up my thinking from going, I'm not going to do that anymore. I'm going to try something different. I don't know yet what that is. I don't know what that is. Well, you already know. Crazy. I don't know. Think about that. Think about that. And if you can use that in your practice, and if you can stop, I like that idea, and this is for nurses and healthcare professionals and for patients. I like the idea of that bedside, if you're in the ER, bringing the other nurse into the cubicle or into the room and saying, this is Joe. And Joe has these symptoms. And I think it's this. And then Joe can say, yeah. And instead of saying, this is a coli. And Joe's like, no, my name's Joe. and I don't know. And nurses, I would challenge you this. If you need a break from it because you're like overstressed before the point of like killing your nursing license, go work at McDonald's or get a job as serving or go work at the Mac store, not the cosmetic store unless you like that, but go work at the Apple store. I get those two confused. People are like, oh, you work at the Mac store, you do makeup? And I'm like, I didn't even know there was a Mac store. And I'm like, the Apple store has a 952 number. It's not an area code for Uptown. So I'm like, half the times I'm like, they never connect me anyways. I gotta like scream into that automated caller thing. I'm like, operator. And I think that if we did all that, what the future would look like for medicine and for healthcare and for profession and for the healthy development of children would change, and we would breed in wellness instead of illness. I think right now we're breeding in illness, not only in genes, but in psychology. And we're teaching illness to kids because you know what we're saying? We're saying, I don't have time for you in my classroom. You're too disruptive. Go to the principal. go to the special education, and then they become, oh, I'm a special ed kid. And then teachers look at that and go, they're disturbed. And then they treat them like that, like they're a behavior problem instead of a child. And you know what? Here's the deal about children. They have behavior problems because that's their job, to learn how to deal with their behaviors. But we compound it, and then it kind of gets exponential. And we say, like I said with the kids, they become a disturbed kid, and then that follows them through life. It starts with school, it starts at home, and then it goes to school, and then it goes to relationships, and then it goes, you know, they talk about you and medicine. I mean, the schools somehow get your information to your doctors, and then the doctors see you as a disturbed child, and then they're like, well, he must have this diagnosis. And then that follows you on to the next level into your adult life. And then you become this, and then all of a sudden you're like, well, you're here too much. You're seeking, drug seeker. And then no one trusts you as a patient. And you're like, well, they started it down here when I was a kid. And now I've become what they made me. And now it's my fault. Well, I'm sorry if the patterns didn't live up to your expectation. Or did they? So what I'm saying is, maybe if we change the way we treat children and we move from this perspective into a different one, or maybe it goes this way, we could change a whole generation. We could change a whole generation. And it might be gradual. It might be like, sometimes change comes, but for the next generation, an elevation in humanity, get away from the pain model and the illness model and move, like I said, into that wellness spectrum. And I bet you kids would grow up to be different. I bet you our thinking would grow up to be different. And our thinking as adults would grow up to be different. Because adults are still children in a lot of ways. Or they should be, so we can learn. If you're always, that's what I said about those Buddhist monks. If you grow up always on the right path, or if you think you're always on the right path and you never have a slip or a fall, then you're always like, and it's okay. And I do like that idea of second career or midlife career changes, where people are like, you have to be, we want you to be alive in the world or in the world before you take a job, like as a community spiritual leader or this leader, or because then you have life experience, or you have the kind of experience we're looking for to do this kind of work. And I think sometimes when people are forced into certain positions, like, you know, families, like the first son is going to be a priest, or the first this is going to be this, and those are the ones that I'm like, do you think those make good priests? Probably not, because they didn't want to do it. Or it's like, oh, it's my job, I gotta, you know, it's an expectation of my family that this is how I'm going to be, and I don't even want to live up to it myself. So then how do I do that? And you know what? I'm not going to talk about my behavior or my choices in my life or my personal life anymore on some levels, because there's a separation in there. Like, there's a separation between church and state, and there's a separation between private and public, and there's a separation sometimes. And what I do is my business and my private life. And I'm talking about, remember we talked about compartmentalizing aspects of our lives? When I was a nurse, I was on as a nurse. And a lot of times I went home and I was like, oh. And I wasn't distracted as a nurse. I was like, I'm here to care. I'm here to take care of people. And I'm like, focused. I know. And you're like, start taking care of you. I know. It's hard. And you know, this helps. This helps talking to myself on video and like, I don't know why. Well, it's because I can look at it again later and go, you were crazy, you know, you know, maybe I can look at it later and go, you know, you had some really good ideas, or I had some really good ideas, or that idea was like, right, I can credit the voices. No, I said that once. I have a lot of people in my life that I need to be grateful for. I wrote it like, I don't know how many times. And a lot of times I don't thank them. I don't thank them. One, sometimes they're invisible. And that's when I get really mad. I'm not mad so much as I get worked up, and then I'm like, then my mind starts going, who's doing it? And then it's like, look. And then I'm like making connections. And sometimes I said, children make connections that aren't there. So do adults. So see the similarity. They make connections that aren't there. And we make assumptions and judgments. Maybe about really good people, and maybe about good people who meant something to be really good, and then, you know, or maybe people meant things to be really harmful, and then it was like, now look what we're stuck with. Either way, sometimes neutrality is the worst enemy to either side.